Hello and welcome to the ELF Medication Safety Podcast. Today we're going to talk about administering medication to the correct person. Alan, this seems to be a basic thing to be reminding people about. Is it actually a problem in our organisation? Do we actually give medication to the wrong people? And if we do, what might be the effect upon the service user?
Yeah, so it does happen surprisingly often in the organisation. So on average, about 15 times a year or so, we'll get an incident report involving a service user receiving medication that was actually intended for someone else. So yes, it does happen. Now the effect of that might be, so for instance, if you give a medication to somebody that they're allergic to, could have a bad reaction to, might give them something that they're intolerant to. We could even potentially end up giving someone the wrong medication that interacts with something else they're already taking. There's the fact that some of the medicines we give, they actually need to have their dose increased very gradually up to a full therapeutic level over time. So if we accidentally administer medication to the wrong person, we might give them that full therapeutic level dose without that gradual increase, and so it could potentially cause serious harm to the service user.
So how can we go about preventing this happening, giving the wrong medication to the wrong service user?
Well, very basically, I guess it involves making sure that the medication chart in front of you matches the person who you're giving medication to. And the medicines policy is actually quite clear about telling us how we should do that. So it says that before we administer medication, we should be asking a service user to state their name and their date of birth. And that's a really simple and effective way to avoid this kind of error.
But if you know that patient, if you work in the ward and you know who that person is, do you really still have to ask their name and date of birth?
Yeah, I know, it's one of those things that does seem quite repetitive, but I still think it's a really good idea, even if you do know the service user, to ask them to state their name and date of birth, just because it gives you that little bit of time to reflect on whether what you've got in your hand is actually what you're intending to give to that person. And so we know that medication administration can be a very busy time, and so anything that the nursing staff can do to build in a little pause into their practice just to reflect on what they've done is a really good idea and could help prevent them making mistakes.
And is it important the way that you ask that question, their name, about their name and their date of birth?
Absolutely, yes. So the wrong way to do it would be to have the medication chart in front of you. You then read out the service user's name and date of birth and ask them, that's you, isn't it? So the service user, they might not have heard you correctly, or they might have a name that's very similar to someone else's, and so they might end up saying that it is them even when it's not. So by far the better way to do it is when the service user comes to you, ask them to tell you their name and date of birth, and then check that against the drug chart. So there's much less chance of someone agreeing to be someone else.
Okay, thank you very much, Alan, and thank you everyone for watching.